Hello everyone, it's Monday, August 29th. It's the 18th episode of the Ask Dr. Khan Show. Thank you for watching live on Facebook. Hi Facebook. And also Periscope. So on Facebook, we're at Hope Integrative Wellness. And on Periscope, it's Ask Dr. Khan at Periscope. Okay? And then this show is recorded every Monday, Arizona time, 12:30. We bring you the Ask Dr. Khan Show where I go over a topic that's relevant to you. That's going to help you stay well and get well, and also answer any questions that you have. So if you have a question on Facebook, go ahead and post it. I'll either answer it live or I'll answer it at the conclusion of this. And I personally answer all Facebook questions, by the way. Also Periscope, if you have any question, go ahead and post it. I'll answer it for you as well. Okay? So my purpose of doing this, keep in mind this is a Monday, so I'm in practice. Okay, so I'm taking time out of my busy workday to do this. Why? Because this information is important. If you haven't caught any previous episodes, please go back to Facebook or go to our blog at askdrkhan.com and watch previous episodes. I'm getting amazing feedback from people who just, they're just grateful. They're thankful for a doctor that's explaining things to them in a way that they can understand it and also give them actionable steps so that you can get better. Okay, so I want you to watch them, and this is free information that I'm giving out to you. Okay, free information because you need to hear this. You need to have hope that there's something else besides drugs and surgery that you can do. Okay? Now, just to give you a little background, I'm board certified in integrative medicine. I'm also board certified as a functional neurologist, chiropractic neurologist, and my practice basically, help people with chronic conditions, thyroid, autoimmune disease like Hashimoto's, like chronic digestion issues, chronic pain, depression, anxiety, brain fog, energy issues, chronic fatigue syndrome. These are the things that we focus on in our practice. And people usually come to us after they've been to multiple doctors, they've been to medical doctors, they've been to multiple specialists, they tried Mayo Clinic, nothing's working, the medications quit working, or it never worked in the first place. Let me ask you this, what do you do when the medications don't work? Right? Taking more medications? If the medication already is not working, taking more medication is not the solution to your problem. Then they swing all the way to the other side, start taking supplements, thinking that's going to work. And it still doesn't work, or it doesn't make them feel better. So what you must do is identify the root cause. So this Ask Dr. Khan show is all about explaining to you all the different pieces of the puzzle that may be involved. We have talked about autoimmune physiology. We talked about thyroid. We talked about different patterns of thyroid dysfunction. We talked about causes of brain fog and fatigue. So today, how sweet it is. My favorite topic. Finally, we're going to get to talk about blood sugar. We're going to talk about blood sugar today. It's a sweet topic, no pun intended. Why is this my favorite topic? Because it's one of those things that has tremendous impact when you address it. If you have blood sugar dysfunction, literally nothing in your body works. And it's such a foundational issue that a lot of people, a lot of doctors actually kind of glaze over it, right? They either don't diagnose it properly in its detectable and preventable stage, or the treatment is just a pill, a drug, which doesn't really correct the underlying problem. And you may be surprised to hear that blood sugar problem is not purely one where you're just eating too much jelly donuts, okay? That's not the only reason. Yes, that is one of the big reasons, but that's not the only reason. There's a lot of other reasons that why your blood sugar will be jacked up, okay? So I'm gonna discuss some of these, common reasons, but also not so common reasons. So you see that it's more than just how you're eating. Some people, they say, wow, I cleaned up my diet, but I'm still having a hard time losing weight. My blood sugar is still not dropping. There's something else besides just diet then, right? Pretty obvious. If you change your diet, your blood sugar is still not right, it's more than just diet. Now, some people say it's genetic. Everybody in my family has diabetes. There may be a genetic component to it, but you know what? You can't change genetics. But I'm going to tell you, though, genetic play a very small part. It's always about epigenetics, about environmental triggers, about what you're doing to your body, what you're exposed to, rather than the genetic component. So don't blame it on genetics, okay? Because if you do, game over. What are you going to do? It's genetic. Just go home and go get diabetes and do nothing. No, there's a lot you can do. Don't give up. That's the whole purpose of our clinic. Our clinic is called Hope Integrated Wellness. I'm here to give you hope, okay? But you got to have the right information, because acting on the wrong information is going to give you false hope. You don't need that, okay? You need the right information. So let's talk about blood sugar. Now, glucose okay, obviously is one of the most important fuel for the body. Your body breaks down macronutrients, and eventually all macronutrients break down into three foodstuff: carbohydrate, protein, and fats. Carbohydrates have simple carbs, complex carbs. All carbohydrate eventually break down into glucose, which is used for energy. Okay, so glucose is important. However, there's always a balance, right? So you say, oh, glucose is important. Let me go drink some juice for energy. No, that's not how you want to do it. Okay, so genetically speaking, human beings, if you look at human beings, people in the paleo community understand, or if you understand the Paleolithic concept, is that caveman, genetically speaking, we're made to be like wild, undomesticated animals running around out there, foraging food, right? We're made to be hunter-gatherers. We eat what we kill, and we eat what we fetch, what we pick off the trees, what we dig up from the ground, right? So agriculture is a much later phenomena. So, our ancestors did not eat much in the way of simple sugar. Okay, sometimes you get some fruit, but that's not the primary of their diet. In fact, the Paleolithic hunter-gatherers ate actually majority a lot of fat and a lot of fiber. Okay, so our body's not built to withstand a lot of glucose at one time, okay, or continuously. And so what happens is in the modern standard American diet, the SAD diet, standard American diet, is loaded with processed carbohydrates, sugar, fake sugars, processed food, and then food that are inflammatory, that triggers inflammatory response that also drives up blood sugar. So at the end of the day, the most Americans are exposed to food or a lifestyle where it's really pro-diabetes, right? It makes it really easy for us to have high blood sugar. And our genes are just not made to withstand that high blood sugar. So a lot of people have a problem with this. Now, normally, what happens is your glucose is very important for brain function. So last episode of the Ask Dr. Han show, I talked about brain fog, depression, and fatigue. And one of the main things about brain function is that it requires two things to function. You remember what those are if you watched last week's show? Two requirements for healthy neuron is fuel and activation. Fuel comes in the form of food that you eat, in the form of glucose and oxygen, right? So you need glucose from the food you eat to feed brain cells, because brain cells operate on glucose, and you also need oxygen to make energy. So you need fuel, and also brain cells need to be activated. Okay, so we're going to talk about specific glucose, but again, brain cells can't function without glucose. In fact, your body's pretty darn obsessed with keeping blood sugar in this tight physiologic range. How tight are we talking about? Well, about 85 to 99. This is really where it should be, optimally, okay? So if your blood sugar is anywhere outside that zone, your body kind of freaks out a little bit. In fact, your body is so obsessed with keeping blood sugar in an optimal zone, it actually controls it with like several different hormones. It has like redundant backup systems, okay? So you have your insulin, which obviously controls blood sugar by taking the glucose from your cell and deliver glucose from the blood and deliver it into your cell. Okay. You also have cortisol. So these two hormones kind of like they're antagonists. They kind of do opposites. Insulin decreases glucose, while cortisol increases glucose. Cortisol is a hormone made by the adrenal gland to help you with inflammation, help you fight stress, but also raise blood sugar. Okay. So what happens is when you eat in between meals, like say you have breakfast at 7. And you have lunch at 12, okay? So between 7 and 12, somewhere along that timeline, your glucose number is going to start to drop. Your blood sugar is going to drop because why? You use up the energy that you have. So as your blood sugar drops, what's keeping it from dropping so low that you pass out, like hypoglycemia? Well, your body adrenal gland will release cortisol to get that sugar up. So what happens is your blood sugar normally will go like this. You eat, blood sugar go up, and then as it drops, cortisol, this hormone, raise it up so you don't pass out from low blood sugar. And you eat again, your insulin brings it down. So all day long you do this. Hey Scott, good to see you. Thanks for joining the show. This is my good friend Scott. He's a big advocate for our practice. Thank you for all the referrals that you sent us. We take excellent good care of them, and I know they're going to get better. And you're helping them, literally changing, if not saving their life with those people that are sending to me. Okay, I really appreciate that. Now, so your blood sugar should be pretty stable like this. So some people, their blood sugar goes like this, like a roller coaster. It's crazy high and it drops crazy low. That's bad. okay? Because your body has to have that blood sugar in this tight physiologic range. Anything outside of that, your body hates it. So insulin and cortisol is the main blood sugar control. And also you have glucagon from the liver that also controls, regulates blood sugar. Your thyroid hormone kind of sort of does that as well, indirectly by regulating metabolism. And it's in fact on insulin as well. And then you also have epinephrine, epi and norepinephrine. These are your adrenaline hormone from the adrenal gland, also produced by the adrenal medulla, that also raise blood sugar. Okay, so you have these hormones that really keep a tight rein on your blood sugar. So when you have blood sugar that's outside of this healthy optimal range, what that means is something is busted. Okay, your hormonal system is busted. That regulation mechanism that your body keeps so tightly under control is not working anymore. That's how you have to see it. When you have diabetes or pre-diabetes or you have hypoglycemia, something is broken. Okay, you have to go find what's broken. Now what happens is when you eat sugary, starchy food, what happens is your sugar level in the blood. So let's just look at this, okay? So here's your glucose. So as your glucose level rise, because you eat the starchy stuff, what does your body have to do to bring that blood sugar down? Well, your body will release insulin. The insulin will take the glucose out of your blood and shuttle it into your cell. So let's, can we see this side of the screen here? Okay, but on the Facebook and Periscope? Okay. So here we have a cell, okay? So let's just say we have a cell. This is a cell. And on the cell surface, there's a receptor. The receptor on the surface of the cell is like a door, like a gate. It kind of only lets certain stuff in, right? It's like a key. It has to match. So whatever this receptor, let's say this is an insulin receptor. The insulin receptor only can attach to insulin. And once it attaches to insulin, insulin will be able to trigger gene response and actually get the glucose in through glucose transporters. So what happens is when you have some glucose, G stands for glucose, so when you have some G's, then what happens is your pancreas is going to secrete insulin, right? So you have pancreas here. This is just physiology 101, okay, the basics. Your insulin will release, pancreas will release insulin, and insulin will get on the receptor, and the glucose will be able to be transported into the cell. And your cell says, yum, yum, happy, I have sugar, sweet, no pun intended. So then your cell will be able to make energy and do what it does. Okay, now once the cell is completely saturated with glucose, got what it needs, the tummy's full, so I can't eat anymore, so any more glucose you give me, I'm going to just store it. Where does it store it? It stores it into fat cells. Okay, fat cell, adipose cells. So then your fat cells get bigger, then that's how you store it. Okay. Now what happens is when you eat a huge bolus of sugar, like a donut, a diet soda, or just in pasta, bread, what happens is you're getting too much G's, okay? Too much glucose. Too much glucose in the blood. Way more than what our ancestors are predisposed to, right? The cavemen, hunter-gatherers. So our body just can't handle it. It's just like, whoa, what the heck is this about? And what happens is your pancreas squeezes out a bunch of insulin. The I stands for insulin. Let's use a different color. You got a bunch of insulin to try to get these glucose into the cell. Okay? When you have more insulin than in a normal physiological response, remember, we're hunter-gatherers. We eat pretty lean stuff, fiber, and then healthy fat. We don't have sugary food, right? Back in the day, people don't just go down to the supermarket and buy a Twinkie and Snickers bar. So what happens when you have all this insulin, your receptor, this door, will start to downregulate. It means the door will start to, instead of being open like this, it'll kind of shut down. So people think like hormone, it's all about how much you make. Like you do a blood test for your hormone. That's just measuring how much hormone's in your blood. It does not measure your receptor activity because you can make the hormone, but what determines whether the hormone goes into the cell? The receptor have to be able to latch onto this hormone. If the receptor is shut down, you can make all the hormone or take all the hormone you want. This will apply to estrogen, testosterone, thyroid hormone, insulin. You can take all the hormone you want, right? Go to hormone replacement therapy, take your hormone pellets. If your receptors are shut down and not letting the hormone in, you can have a bunch of hormone in the blood, but nothing's going into your cell. In this case, when the receptor shuts down against insulin because you have too much glucose in the blood. This is called insulin resistance. Okay? Insulin resistance means the cells no longer are sensitive to insulin. They're resistant to it. So even though you got a bunch of insulin, it doesn't work. So what happens when you have insulin, it doesn't work, guess what? Then the glucose can't go into the cell. When the glucose can't get into the cell, guess what? You have a lot of glucose in your blood. That's hyperglycemia. That's your diabetes, right? That's your high blood sugar. Even though you have a lot of sugar in your blood, how much sugar do you have in the cell? A lot or a little? Which one? You'll have very little glucose inside the cell. This is diabetes. In people with diabetes, you have sugar in the blood, but no sugar in the cell. So your cells are starving and dying with no energy production. That's what's happening in diabetes. So people think like, oh, I have too much sugar in the blood, so I should have plenty of energy. No, you still feel fatigue, right? I mean, if you have insulin resistance or you already have diabetes, you know, you're tired, your brain don't work, you have brain fog, you gain weight. None of your hormones work because when you have insulin resistance, when you have too much insulin is toxic at high levels. This will basically block your hormones from working. Your thyroid hormone won't work, your estrogen won't work, your progesterone won't work. Insulin resistance, when you have too much insulin, that means insulin resistance means you have way too much insulin. It's not working anymore. Now keep in mind you can have insulin resistance from taking insulin also. So if you're type 1 diabetic, you're taking insulin, guess what? The more insulin you take, the more resistant you become of it. So when you're type 1, it becomes a slippery slope. It's a bad situation. You really need to do a lot just to keep yourself from not needing as much insulin. Okay? I'm going to go over that in just a little bit. So in people with diabetes, you have too much insulin, and therefore you have too much sugar in the blood because none of the sugar could get into the cell. So your cells literally die because of no energy. You're starving them to death. If this cell dies, it's in your brain, guess what? You're going to have brain fog. You're going to have fatigue. You're going to have depression, just like we discussed last time in your last episode. If it's in your kidney cells, they die. Okay? If whatever cell it is, they're going to die with no energy. The brain cells are most susceptible to it, especially in the peripheral nerves. The nerves in your hands and feet in the distal extremity, they're most sensitive to blood sugar fluctuations because with no energy, those cells die first. Okay? That's why you get peripheral neuropathy in people with diabetes because those myelinated nerves, the nerves that cover with myelin, they're large diameter nerves. That means they take a lot of upkeep to keep them alive. They die first, and they're heavily populated in your hands and feet for proprioception. That's why you get diabetes. Okay? Now, when you have high insulin, this will block your thyroid hormone, make your estrogen and progesterone not work. High insulin will also block neurotransmitter production. It'll block the neurotransmitter like serotonin and dopamine. And really, most all transmitters, acetylcholine as well. So these neurotransmitters won't be able to produce because of high insulin. Then you have depression. You have lack of, you get moody, you get cranky. You just feel like you lose joy in activity. Nothing seems pleasurable anymore. So what happens when people have depression, they give them Prozac instead of treating the underlying root cause, which is insulin resistance. See what the problem is? You end up getting qualified for more and more drugs and more medication that does not solve the root cause, in fact, make you worse. Okay? High insulin is bad. And blood sugar, high blood sugar that can't get into the cell, all this sugar just accumulates in the blood. What happens? They cause glycated end product. Basically, it causes glycosylation, which is a term that describes damage caused by blood sugar. Blood sugar, they kind of clump together. Sugar in the blood, they clump together. You ever ate sugar you spill juice on a tabletop and then they get sticky? That's what happens in your blood vessel, man. The sugar kind of clump together and they plug up the capillaries at the ends of your fingers and toes. And what happens? You get poor circulation and you get gangrene. Diabetic gangrene is the #1 cause of limb amputation in the United States. Okay, the #1 cause of limb amputation from blood sugar problem. Now, neuropathy and poor circulation and all that stuff can start to happen in the pre-diabetic state. In fact, pre-diabetes is no different than diabetes. The only difference is you qualify for a drug when you have diabetes. But the physiologic damage is already occurring. So don't take this lightly. Okay, now, Also, when you have high insulin in males, in guys, high insulin will cause your testosterone, the one that you want, to get converted into estrogen. So what does that mean? That means you're going to get belly fat, you're going to gain weight, you're going to develop man boob called gynecomastia. So you see these guys walking around, they're overweight, they got a man boob. That's what's happening, man. When you have high blood sugar, your testosterone gets converted to estrogen. You have low libido, so guess what? You get another pill, Viagra, because you can't get it going. Fix the blood sugar. And then, but guess what they send you to? They send you to a doctor that, oh, I want to give you a testosterone androgel. I want to give you testosterone medication. Instead of fixing what caused that testosterone to be low in the first place, because it's all turning into estrogen. In girls, when I say girls, I mean females, when you have high insulin, it converts estrogen into testosterone. So basically, when you have high insulin, it turns guys into girls, turns girls into guys. Not good, okay? Insulin resistance is number one causes polycystic ovarian symptom, PCOS. And PCOS is the number one causes infertility in America. So like our fertility rate's going down. You think like, well, you know, medicine's so advanced, people living longer. No, we're not doing very good. You know, fertility rate's going down, okay? And insulin resistance is the number one cause of that. Insulin resistance in girls will cause them to have high testosterone, which will cause facial hair growth. So, you know, a goatee on a woman is not very sexy. I don't find it sexy. You know, it'll cause you to gain weight, very difficult to lose weight. It'll cause a bunch of hormone problems. I mean, and the estrogen is cardioprotective and neuroprotective for the girls, while testosterone is cardioprotective and neuroprotective for the guys. So then you have cardiovascular risk. Okay? So this is how blood sugar can throw off your hormones, throw off your neurotransmitters, throw off energy production, throw off your brain. Not to mention diabetes, high blood sugar is basically it's going to lead to eventually heart disease and stroke. Basically, when you have diabetes, just say you're going to have heart disease and stroke. That's what's going to happen, without a doubt. And most people on diabetic medication end up being on high blood pressure medication, end up being on heart medication. If you already have diabetes, you know. And if you don't have diabetes, oh, my doctor said I don't have diabetes. That means you don't have diabetes yet. Guess what? I just read a study that says about half the American population have either diabetes or prediabetes. Half of Americans. I mean, that's just crazy. So somebody's making a lot of money off of this, right? They're making money off of selling the drugs for it because they don't teach you how to get out of diabetes, because if you don't have diabetes, there's no need for diabetic drugs. Now, I'm not saying like some people don't need diabetic medication, but certainly even if you are diabetic and you're already taking medication, it's your duty and your obligation to eat better, to change your lifestyle so that you can start to normalize your body function and hopefully take less of those medication and maybe even eventually wean off. That's your duty and obligation, because diabetes is a killer. The cost to manage it is going to break our country. This is a major health problem. It's epidemic. We all need to be responsible for it, because if we don't fix it, we're all paying for it. Okay? Is that insurance paying for it? No, who's paying for the insurance? Coming out of your pocket and my pocket. So we got to fix this problem. Okay? Now, what happens is, as you continue to becoming more insulin resistant, eventually your pancreas is going to crap out. It just can't make enough insulin anymore. And in fact, this medication like metformin and these diabetic medication for type 2 diabetics, basically they're just trying to get you to make more insulin, just kicking the pancreas butt to make more insulin. But guess what? Eventually, you just become more and more insulin resistant, because as you continue to, so what those medication does is it make your body to produce more insulin. Well, that's going to make your blood sugar go down, yes, but more insulin will cause more insulin resistance, which actually exacerbate the problem. Furthermore, it's going to cause glandular fatigue. So eventually your pancreas fails, you become type 1 diabetic, or you become insulin-dependent diabetic. Okay? Then that's when it gets bad, because then for the rest of your life you need insulin. And then the more insulin you take, the more insulin resistant you become, and this gets worse and worse and worse. And it leads to all the problems, the heart disease, the stroke. In fact, diabetes is so bad for your brain that in the research, scientific literature, they're starting to call diabetes, or they're starting to call Alzheimer's disease, type 3 diabetes. Okay? That's just how much correlation there is between blood sugar dysfunction and Alzheimer and neurodegeneration. So for sure, you need to address the blood sugar. So when you become type 1, that's when your pancreas are making insulin. Now, some people have type 1 diabetes because they have autoimmune disease to the pancreas. Okay? If your immune system is attacking the pancreas, destroying pancreatic islet cell, where it makes insulin, then you're going to have type 1 diabetes because you can't make it. So this will be kids with type 1, juvenile diabetes. Usually they're type 1 unless they're really overweight. And you can have adult onset. This is called diabetes type 1.5. Okay, so these are adults that have diabetes, and they either have type 2 and then they started getting antibodies to the pancreas, so they started becoming type 1 because they have autoimmune to the pancreas, or for some reason they have an infection, they have some kind of toxicity issue that triggered autoimmune disease, and now it's attacking the pancreas, and now they have diabetes. That will be autoimmune diabetes. Now, it doesn't have to be just islet cell. There's several different markers you need to check. You need to check islet cell antibody. You need to check GAT65 antibody because you have an enzyme that actually could make insulin, so you need to check if you have autoimmune against that. You can actually have insulin antibody. You can actually have autoimmune against insulin. So these people are really in bad shape because they can't, take insulin, it's going to cause problem for them. Then they have to take some kind of non-insulin diabetic medication like Byetta or something like that. Okay, so that's diabetes. Okay, now I haven't got into the neurological aspect because there's so much to talk about with this. So we might do that next week. We'll talk about neurogenic dysglycemia. What does that mean? That means you can actually have a neurological problem causing blood sugar issue, not because of diet. You can also have a neurogenic or inflammatory diabetes where you have some kind of inflammation that's driving up blood sugar that's independent of your diet. Okay, so some people, they eat perfect, they still have high blood sugar. Like, what gives? You may have a neurological cause for that, where you need to fix the actual root cause, which is the brain, or you may have some kind of hormonal inflammatory issue where you need to address the root cause of the inflammation and not necessarily blood sugar itself. Okay, so we'll talk about that next week. So hopefully you got a lot out of this. My purpose is to help as many people as possible with information like that. If you know someone that has diabetes, pre-diabetes, or hypoglycemic symptoms, please share this video. This is not a joke. Okay, this is a serious condition that affects, many different parts of the body. People tend to think like, oh, blood sugar, there's a drug for it. The drug is not your solution, folks. You must change your lifestyle. You must do a lot of things, okay, because there's multiple costs for that. Good resource for you, Facebook page, Hope Integrative Wellness on Facebook. There's free videos. One place I want to point you to, AskDrCon.com/gut repair. Okay, that's where we discuss an eating plan that not only help heal the gut and restore GI function, but also help stabilize blood sugar. Kind of 2 for 1. Okay, that'll really help you. That's free for you to watch. Just go to AskDrCon.com/gut repair. Okay. You go there, you can request a free video that'll really help you, and it'll go over a program that'll help you to balance your blood sugar the right way, and that's lifelong, sustainable, right? Not like, oh, let's do it for a month and then go back to eating donuts again. That's not a lifestyle. You got to do this for the rest of your life, okay? So I care about you. I want you to really get the free information. Please go to AskDrCon.com/gut repair and download that. There's a video, and also there's other information that's there that'll help you. In the meantime, hope you have a great week, and I look forward to seeing you next week at the Ask Dr. Khan show, Monday at 12:30. This show will be recorded, so go to our Facebook and then also at our website. So thank you so much for watching, and we'll see you next week.